Don't worry, get married. That was Prime Minister Loong's National Day rally message to couples who were delaying marriage plans due to existing home prices. To help home buyers cope, he announced, firstly, step-up housing grants to help homeowners upgrade from 2-room flats to 3-room flats. Secondly, expanded special CPF housing grants to give middle-income households up to $20,000 more to buy a 4-room flat.
The new efforts, basically the housing efforts, will be quite beneficial for a lot of the those who are newly married, starting up their own families. So by making it easier to get houses and capping the value of the new BTO flats and stuff, that will definitely be a big boost for all those new couples.
I feel that the standard of living here is a bit too high, so I think that this amount is a bit too little, I guess. So I guess it should increase a bit more to help us subsidize the flat.
Even though that household with lower income can afford the flat, but I still think that the loan period is too long. Yeah, because it's like 25 years. So that means if like a normal working adult who is like 25 years old, I have to work all the way to 50 and more to continue repaying my loan. So that to me, I think is still too much.
I think it's good. It will encourage more people to start family younger.
Growing old and its associated health problems will also be softened by revamping the current MediShield to cover all Singaporeans for life, rather than stopping at age 90.
They are recognizing that there are more and more people who are, the life expectancy of a human being is getting more. So it's a good move by the government to take care of the elderly actually.
The new MediShield Life will also cover pre-existing illnesses and include more outpatient treatments, and outpatient subsidies will now be made available to all, regardless of age or income bracket.
It's definitely better when you expand the scope of the usage of this MediSave. Of course, definitely for the lower income families, they will greatly benefit from it.
The medical bills is really too high for certain low income people. So these subsidies will really help them in the sense that they don't have to pay so much, and it also balance well with the higher income rates.
It's good to have a good social safety net for the low income, for the elderly. But then again, it's a matter of cost, and this cost will definitely be passed on to some other groups.
I think we should study into what sort of illness most of baby boomers will get contacted, like maybe diabetes or cholesterol issues or heart issues or knee issues, bones issues. These are the things that we will need high expenditure, hospitalization, surgeries. These are the things that the baby boomers or older generation will need more. Alright, well, younger generation, they mostly covered by work, by their employer, by the companies. So it's the retired or the sandwich generation, maybe for housewife, for homemaker who are not employed. So it could be a burden on the family.
Stay tuned to our next clip to find out what Singaporeans think of the changes to the PSLE scoring.